So, well, number one, I think just as a woman, I'm very passionate about women getting proper screening, doing breast exams, and not being afraid to come forward if they find something. I want them to come forward before, I don't want to say it's too late because it's never too late, but I want them, early detection is so much better than waiting. And on a personal level, I have my best friend from all time had breast cancer and had to go through chemotherapy, and so just important to me. Good. Or I became interested in oncology in medical school. I just thought it was fascinating how one little misstep in our DNA could lead to this whole cascade of issues. So I like the scientific part, but I also like taking care of patients in one of their toughest times. When a person's diagnosed with breast cancer, I generally think of it as a two-phase approach. The first is the local treatment of the breast cancer, and by that I mean treating the breast itself. So that's usually done by a surgeon, and their options would include lumpectomy or mastectomy. For a lumpectomy, the patient has to sort of meet the right characteristics, meaning that breast cancer has to be below a certain size or in a good location to preserve breast cosmesis, or the way the breast looks. And then if you undergo lumpectomy, it's followed by radiation. We know that lumpectomy versus mastectomy have the same outcomes for patients, the same rates of local recurrence, and the same longevity. So that comes up to sometimes a technical issue or a patient preference. And then once a patient's done with the local therapy, then they come talk to someone like me about what we call systemic therapy, or trying to reduce the risk of the breast cancer coming back. The options that are available for surgery we touched on, then the options available for systemic treatment depends on the characteristics of the cancer. So some breast cancers are fueled, or they use estrogen to help them grow. It's their food. So sometimes we can take advantage of that and starve them of their estrogen supply. Sometimes breast cancers are driven by this other process that we call HER2, and we can take advantage of that by giving an antibody or an antibody to the HER2 found on breast cancer cells. What drives options for treatment are the characteristics of the cancer, patient preference, and then years and years of data about breast cancer and the best outcomes for patients. So we like to give people the options they have, but the right options. So not all patients with breast cancer need chemotherapy. In fact, there are some tests that we can do now where we send off the tissue sample to see if that cancer is more likely to come back and what the risk is, and we can use that specific number to determine whether or not a patient needs chemotherapy. So it's much more precise now than it used to be, and we save a lot of women from having to undergo chemotherapy. It is scary, and I think, I don't pretend to know why people are afraid to undergo mammography and screening, but we are getting much better at determining who needs what kind of treatment and sparing a lot of women treatment that they don't need. At Grand Mesa Oncology, we offer different integrative options, including massage therapy and physical therapy, for instance, physical therapy for lymphedema. Lymphedema is swelling of the arm after a woman's had a mastectomy or has had her lymph nodes taken out of her armpit. We have physical therapists that specialize in lymphedema management, and they're located in our outpatient part. We offer yoga for anyone who's been a patient at Grand Mesa Oncology or any cancer patient outside the county. Grand Mesa Oncology has a great team of providers, whether it's the mammographers or the radiologists reading the studies, and our surgeons. We partner with the radiation oncologists in Montrose, so it's a great team and a great community.